as to the number of those who are hooked on drugs and substances, you would realize that if just one person in a family has a drug use problem, it brings an enormous distress to the family members, to the community, to the society in general, and of course to the development of Nigeria. So I'm excited that we're having this discussion today, and I'm sure that there are many families who are listening today who would want to ask one or two questions.
True. And you can watch us live on YouTube, Facebook, and at Eagles FM Abuja, and together let's look at the issues together. And you can also call us on the program.
Yes, you can call 090-7353-0044, 090-7353-0044. Also, you can also call 090-8766-8888, 090-8766-8888.
Okay, so you can call us, you can ask questions. Dr. Hope Omeza is the Executive Director of VGAD. Did I call that? Okay, all right. Specialist Rehabilitation Center, Abuja. He's a guest today. So, Doc, the issue of drug abuse is a major challenge to societies and authorities in Nigeria and globally, and the resultant effects have strangled a good number of our youths, reducing them to be grossly unproductive and exposing them to the high level of criminality, as against investing the energy in worthy economic activities. Let's look at the situation currently in Nigeria, especially as it concerns the use of illicit substances by women, children, and even the youths themselves. What's the situation like? Because I know you've been on the field, you're dealing directly with the situation. How is it like right now?
Well, it's indeed a pathetic situation. Going by statistics, last week still have to make reference to what's done in 2018, which the effect of National Drug Use Survey by the National of Some Crime, the NDLA, and the Ministry of Health. And that puts the drug use situation of about 14 to 15 million Nigerians, between the age of 15 to 65 years old. Now, that being said, we also have seen that these statistics may have changed over time, because isolated researches in various communities in secondary schools after 2018 has shown a high rise with respect to drug use behavior, not just with young people, but even elderly individuals. And again, the research showing in 2017 that we have 1 to 4 male to female to male ratio. That is, if you have 4 people taking drugs, 1 is a male person and the other is 3 are males and 1 is a female. However, that seems to have changed over time, and this is majorly because female individuals who have used drugs may not have the energy or the capacity, both financially or socially or culturally, to want to approach or engage for treatment as compared to male individuals. And then again, if you ask a young female, do you take drugs or do you use any substance, the likely answer is no, because of cultural values that she knows that will not be in support of her behavior. This is not to say that the cultural values support male drug use behavior, but we know that if you see a young man who is smoking marijuana or cigarettes on the street, nobody may probably raise an eyebrow or try to chastise the person. But if you see a female person, you're like, oh, can you imagine this girl? So these are some of the reasons why you won't see more researches or more data attest to the fact that we have female individuals who use drugs than are recorded on our statistics and data. Then again, talking about females who use drugs, it is very important to understand that they have their own peculiarity as it has to do with their physiology. I mean to say their hormones now, because they have a monthly cycle behavior that borders around changes in their hormonal system in their body. Now what happens is that a particular phase in their cycle has a high rise of a particular hormone. I'm very careful to mention specifics so that people don't get curious and want to try 1 or 2 out. Now, so at a particular stage in their cycle, women are more prone to getting addicted to use of substances because they get more high with the use of those substances compared to other times in their menstrual cycle. So this is one reason why a term called telescoping is faster in women than in men. This term simply means that the time between the use of a drug to when the individual will need help to stop taking the drug is shorter in women than when compared to men.
Okay, doctor, I want us to talk very well today on the health implications. I've been talking to some persons, and some people say, look, this doesn't have any effect on me. I mean, a young one was telling me that, taking in the hemp is medicinal. Is that right? What are the specific serious health consequences of misuse of drugs?
Okay, you see, there have been a lot of argument around legalizing or not legalizing marijuana use, and you see, this has been a big challenge with understanding the Nigerian situation. In 2019, my organization happened to be the first to organize a national conference with respect to whether Nigerians feel that they are ready, to legalize marijuana. Now, we didn't just do the national research, we also had a conference in 2019. Now, this had attendance of various stakeholders, including the UNODC, including the Ministry of Agric, NOA, and other stakeholders, and NDL, of course. Now, the conclusion with that conference showed that Nigerians were not ready for legalization. Most arguments is this. In fact, the late Governor Okerelu of Ondo State had earlier opined that we should legalize marijuana for the economic importance. However, we are making cases here and there that, see, it's not just enough to legalize marijuana use, but then what about regulating it? Are we able to regulate what we want to legalize? So legalization is different from regularization. Now, that being said, some have said that there are other over-the-counter medications that are being abused. For example, commonly tramadol. Now, do we now take them out of the market because they are being abused? No. But you see, these drugs that are being legalized and are being used, we have seen a poor system of regulation for these drugs. So do we add to our burden by legalizing marijuana? Now, most times we are quick to copy policies of Western countries, but we're not also careful to try to understudy the consequences of those policies in those countries, which they may not tell us. Now, but they will tell us, oh, we legalize this, we legalize this and that. Now, do we understudy what are the consequences of those policies they are implementing in those countries? And researchers have shown that some of the states in the US that legalize marijuana have seen a rise with abuse of marijuana. So these are areas of concerns for policy formulation and policy, implementation. That being said, let's look at the health consequences of marijuana use
and other drugs.
And other drugs. In fact, I have a patient whose sister told me, said, we told her the brother has tested positive to marijuana, and I was like, oh, just marijuana. And I told her it's not just. I have seen most of my patients that have had severe mental illnesses upon admission or at presentation has most of the time addicted to marijuana, not even the other drugs, which I wouldn't like to mention. Now, so look at that. So we commonize marijuana and think that it's just something natural in some areas of Edo State and Ondo State. You hear them telling you that their forefathers who were farmers will take this and do this and do that and do this with it. But however, we do not also understand that we do not have the same biological makeup. So an individual can take chloroquine, for example, and it itches a person. Another person even chew the chloroquine and even abuse the chloroquine, but no itching. That tells you that you are not Mr. A and you can't be Mr. B. So if you do not know which, of course, we will never know which category you fall into. There's no test you are going to do to be sure that you will be good with marijuana or not. So, and then you follow an individual who has been taking marijuana and seems to not have
be okay. Yeah.
Now, so you see, so then, and you do that. I've had several people who tested for the first time in their life, and they were rushed out to the facility, and they were in treatment for months before they could recover. Now, so that being said, it affects their mental health. I will start from there first, because mental health is one area that seems to be very lonely. Even for those of us working in that space, you see little concern, little support and encouragement in that area. Unfortunately, this is the area that has been affected the most. The mental health talks about your psyche, your mind, your brain, but then it is the least that we pay attention to. Even in your health insurance program, you don't have mental health illnesses and treatment factored into your insurance programs. Now, so why that? So, and then the whole stigma around mental health, illnesses, is another thing to worry about. So that being said, if you get yourself involved in some form of mental illnesses from the use of marijuana, it says that you have a lot to do with yourself than the public willing to support you. So the support system for that is very poor. Then again, studies have also shown that those who take, who smoke, like marijuana, it affects their lungs. I can't say much on this. I mean, there's so much data outside there to be discussed. You talk about their kidneys. I've had several patients who had to be on dialysis for years, and eventually they lose their lives. And some had to be, moved abroad for kidney transplantation and the rest of the thing, which most families cannot afford.
Of course.
So these are the challenges. Do you talk about other consequences with, social consequences, relationships in the family? Do you talk about financial mismanagement and the rest of it? I mean, most of other issues that are attending to drug use.
Okay. Thank you, Dr. John. I want people to call us on this program because the doctor is here. Let them call and ask questions, because the doctor will be able to answer so many of them for them.
The number to call is 090 73 53 0044 090 73 53 0044. There's still another number 090 87 66 88 88 090 87 66 88 88.
Okay, John, government and other relevant agencies have been on the business of fighting drug abuse and addiction, but instead of reduction, we're seeing increase in the rise, for demand and use of some of these drugs. I'm wondering why it is always like that.
Well, I think I'm seeing a situation whereby it's the feeling. Is it the euphoria?
It's difficult to stop, right? Once you start, the intangible element, which is the addiction. You cannot feel it, you can't touch it. But the people who are involved and indulge in the use of these drugs, they are the ones who understand how they feel. The high, how it is. So when the addiction is already established, it is very, very difficult because of they want to keep on going back. They want to keep on going back all the time to have that feel. So that's why even sometimes when somebody is even trying to go through some kind of rehabilitation or some kind of treatment, you see the withdrawal symptoms. So some of them will start falling sick. And so they want to go back
they want to
for
return.
treatment.
So some people will be physically shaking. You see them shaking, and the only thing that can bring them back to normal again will be when they are given the same treat again. So it's a phenomenon.
Okay, Doc, let's look at treatment and rehabilitation. You have a facility here in Abuja, right? Okay, so tell us about it. What is the situation like in terms of management and treatment of people affected? Because I know when you move around, you see lots of people with signs of what will I say, consequences of drug misuse, and you see them moving around. Lots of times you see families just getting angry with the persons instead of finding help with them. Have we gotten to that point where we understood completely the need for treatment and rehabilitation?
Well, this is another area of great discussion. You see, to first of all say one or two on what Mr. John had answered with respect to why they rise.
Yes.
You see, it's not first of all, it's not because there is a sporadic or necessarily a new rise. Drug abuse has always been there, but unfortunately there have not been so much concern to it. It's just like what you don't find, you don't see. So maybe the awareness to find it is becoming more, and so we're like, oh, has it been around us? Yeah, so that's one. Then secondly, I have always advocated that there are many ways to drug control, which, for example, the NDLA has been top in their game with making arrests of those who peddle drugs and traffic drugs. Now, we must pay attention to drug demand reduction as well, which is where what you are doing now falls into that category, creating the awareness, creating necessary sensitization for policymakers who will make policies and take actions for implementation. Now, if we don't do that, you already have a teeming host of users who are addicted to it. And these people will stop at nothing to get the drugs. So they form a ready market for anyone who wants to venture into the business of selling drugs. Because you will always have the market if you don't deplete those who are hooked on this substance. It's like somebody telling you, oh, food business will never fail because people must always eat. So now, because people must always be hungry, the same thing, if you have people who are always hungry for these drugs, you will always sell what you have to sell. And so if the law enforcement agents come hard on you or come harder at you, you also increase the cost of what you are selling because they will buy. All right, so these are some of the things. So while we intensify efforts in, towards drug supply reduction, we should also intensify effort towards drug demand reduction, which includes awareness programs, sensitization programs, and of course treatment. If you don't treat those who are already hooked, you will have them seeking for suppliers. You will have them feeding the suppliers. So that brings us to now, are we even ready? Do we feel we are at the point where we need treatment for those who suffer drug use behavior? You see, a lot of awareness still needs to be created. 2022, I think the theme for the International Day Against Drug and Trafficking, June 26, 2022, was majorly on care first, that is, care for those who are into drug use disorder, who are affected. And we are raising advocacy that drug addiction should be seen as a public health concern, and of course a chronic health illness. For example, someone has hypertension, is a chronic illness. Diabetes is a chronic illness. The same chronicity goes for the definition of addiction. We define it as a chronic brain disease. It's chronic, it's relapsing in nature. Okay, so the same thing for hypertension is a chronic illness. Now, you don't see someone suffering from hypertension and call the person hypertension, or somebody suffering from diabetes and call him diabetes. You call the person by his name. But in the case of someone suffering from addiction, you look at him and say he's an addict. But you don't see somebody and say diabetes, hypertensive. You don't refer or label an individual with those terms. But in the case of someone suffering from addiction, we tend to stigmatize and label them with terms that are not favorable. That being said again, addiction is a brain disease. When we realize that it's a brain disease and there's an organ identified to be worse or most hit by this illness, then we can also begin to think well. Because you are able to understand that hypertension is a heart disease or blood vessel disease. So you can understand. But if you also understand that addiction is a brain disease, not something that the person just wants to be doing. The person who is addicted do not just want to be behaving in that manner. He is under the control of that substance. I've always said that the first time someone takes a particular drug is voluntary. He took it with all his senses, with all control, with all sense of responsibility, either for peer pressure, either for whatever reason he decided to indulge. Now, subsequently, when you see somebody is addicted, that person does not have control over that anymore. The person is a sufferer. He is suffering. He is sick. He needs to be treated.
We should look at drug users as sick people.
Don't look at it from the point of moral failure, or you start blaming the parents. Oh, you didn't do this well, adding more anxiety and distress to the families who are associated with this person.
Okay, Doc, so what should be the right thing to do? I always think that it's better for us to prevent our young ones from entering, because once you start, it becomes difficult to stop. So give us some few tips. We're almost done with time. How do we prevent our young persons from getting into it?
Okay, you see, now we should look at, because already drug is with us, so we can't say primordial prevention. In public health, they will teach you that, there's primordial mode of prevention, there's primary, secondary, and tertiary. Now for primordial, it's for something that is not with you already. You already have drug everywhere. Now we should look at primary prevention, for example, which means that how can we separate or prevent young people from having contact with this substance? Then environmental policies has to come in place. Then child drug education has to come in place. Then we need to begin to teach children on how some social skills that will assist them to handle stress, solve problems, build self-esteem, build self-confidence, respect for personal space, and some other, assertiveness skills and other social skills that are important. We need to begin to teach young people so that when he gets to school, he is able to, make firm decisions, because he will meet with somebody who will say, try this.
Yes.
All right. So we must also begin to create a safe haven for our children at home. I say it a lot that young people have problem with identity. Okay, because in the house, his opinions are not respected. He says this, when you're ordering your chair set in the parlor, you don't care asking him. And even if he decides to say, Mom, how about if this chair is here? He probably will reply, don't worry, what do you know? Now, but this child gets to school and he has a gang he's relating with, and his opinion matters. He begins to create identity with that gang, and then begin to seek and practice what that gang does. So we must create safe haven relationships with children where they feel safe to talk to us.
Okay.
That will help.
All right. So finally now, someone may be listening to us now, and the person is struggling with drug use disorders. In just a few seconds, what can you tell the person? Is there hope?
Of course, I go by the name Dr. Hope. So
yes.
There's hope. I've seen several. I mean, the Dr. Hope speaking here right now was a user.
Okay.
And I started quite early at the age of 11 years. Yeah, so if I can be here today, there is hope for anyone.
Great.
I've also, in my practice, I've also seen several people coming and turn out to be productive, and they are good. There's
so, okay, I'm sure would